I am the face of Black Maternal Health. I'm Gladys Velarde. I'm a cardiologist and direct the fellowship program of cardiovascular disease at the University of Florida in Jacksonville. I have seen firsthand what maternal health means to the Black and Brown community. And as a Brown woman, I can tell you my own personal experience. I have 3 children, and all my pregnancies were difficult, and some of them were extremely dangerous. It was noted during the last trimester of my second pregnancy that there were problems with insufficiency of fluid around the baby. That condition is known as oligohydramnios. But this was known almost at the end of the pregnancy because I probably, even though I'm a physician, did not pay attention to some of the signals that my body was telling me. So my second pregnancy was premature, and he weighed 2.5 pounds and needed and required treatment follow-up after that. That was a very, very difficult time for myself, my family, but fortunately he's grown into a normal adult now. My third pregnancy, which was several years later, the baby was fine. It was going to be a C-section. It was planned. It was a high-risk pregnancy for what had happened before. But I suffered another condition, and that condition was that after delivery of the baby, the uterus would not contract to its normal size, and that's called uterine atony. And what that translates into is bleeding. So I bled, and I bled a lot, and I needed transfusions, and that was something that I had to recover for quite a bit of time after that. And having a new baby and having to recover from a near fatal experience was something really, really difficult. So when I was asked to speak about maternal health, Black maternal health, knowing the data as well as I have seen it on my personal patients, knowing what I have gone through, I jumped at the opportunity of being able to add my voice to this campaign. As a voice of someone who have seen some of my Black patients undergo tremendous hurdles because of what they face with what is supposed to be a joyous, beautiful occasion. And how this represents, a gap in the care that we deliver, in the education that our patients have, and our physicians and our care providers, OBGYNs, internists, have, and the responsibility that we have as a community to bring these voices together so we can close these gaps. But we have to be cognizant that there's a risk associated with Black women when they go through this wonderful period that we need to be aware of, prepare for, and educated as much as we can. So I am the face of Black maternal health.